Next witness.
William Spicer.
William Spicer, please. Mr. Spicer, if you'll come to the front for me, please. And straight up here, if you raise your right hand, the clerk will administer the oath to you, sir.
Do you solemnly swear or affirm that the testimony you give shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you.
All right, sir, if you'll come right around here and have a seat for me, please. And if you scoot up a little bit and speak right into that microphone, speak loudly so everybody can hear you.
All right.
That's good. Thank you. Ms. Corey, go right ahead.
Yes, Your Honor. State your name for the record, sir.
William Spicer,
Spell your last name.
S-P-I-C-E-R.
Do you work for the Jacksonville Fire and Rescue Department?
I do.
And can we refer to that from here on as JFRD?
Yes.
Thank you. And what is your position with the JFRD?
I'm an engineer.
Okay. And are you also a paramedic?
I am.
And can you tell this jury about your experience to become both an engineer and a paramedic?
I used to have to go to EMT and paramedic school, and engineer is a driver, essentially.
And what does it mean to be a paramedic?
You're able to do advanced life support. You're able to give drugs, do more than a basic EMT can.
And do you assess a patient's condition when you arrive to see what treatment can be rendered?
Yes.
And is all of this done on an emergency basis?
Yes.
When did you join Jack's Fire and Rescue?
March 22nd, 2010.
And have you stayed abreast of current training techniques since that time?
Yes.
All right. Let me ask you, sir, what is your current assignment with Jack's Fire and Rescue?
I'm an engineer on Engine 5.
What part of town?
That's in Riverside on Forest Street.
Are there times when you as an individual and your colleagues at JFRD are assigned to different stations just for one night?
Yes.
And does that happen frequently?
Yes.
And does it depend on the need of a particular station at the time
Yes.
that you're assigned? Then let me ask you, sir, what was your assignment on November 23rd of 2012?
I was working at Station 44 on an overtime shift.
Where was that located?
That's on Western Way off of Bay Meadows.
Bay Meadows Road in the south side?
Yes.
Had you worked at that station before?
No.
Now, on that night, were you part of a team that responded to the Gate gas station at the corner of Bay Meadows Road and Southside Boulevard?
Yes.
Let me ask you before we go on to that, sir, are notes made in the normal course of any run by JFRD? Do you all make notes when you go on a run?
Afterwards, during the run, no, we're focused on patient care.
All right, but at or near the time then, as soon as you're done with the patient, do you then document what you've done with that patient?
Yes.
And do you have computer records that are maintained by your department that document the times of a particular run for rescue?
Yes.
Okay. And are notes, those notes then put into a computerized record that's maintained by your department?
Yes.
And do you have a report pertaining to this case here with you today?
Yes.
I would ask you to have that ready to refer to if you need it to refresh your memory.
Okay.
Judge, if I could just state in mind that it's not to be from it, just to refresh the record.
Sure. If he needs to do it.
If you need to, just refresh your memory and then answer my question. Sir, were you one of several units to respond to the Gate gas station at 8251 Southside Boulevard on that evening?
Yes.
And is that located in Jacksonville, Duval County, Florida?
Yes.
What time did the call come in to JFRD?
It was received at 7:43
PM.
p.m.
What was the nature of the call dispatched to you?
GSW, gunshot wound.
Thank you. And does that make it a priority for JFRD to get to the scene as quickly as possible?
Yes.
How many units went from your location?
3, an engine, a fire engine, a ladder truck, and a rescue unit.
Now, why does anyone other than a rescue unit respond to gunshot wounds?
For assistance. There's lots of things going on.
And are all of the members of those units trained to perform certain types of life-saving measures?
Yes.
And what's your specific training when it comes to assessing a gunshot wound patient?
It depends on the needs of the patient.
So you can't determine that until you get there.
Right.
Do you take equipment with you to plan for any possible method of treatment to save that person's life?
Yes.
And was all that equipment taken with all of you that evening?
Yes.
When you pulled into the Gate gas station, was the Jacksonville Sheriff's Office there? Did you notice any units there?
I don't recall if they got there before or after us.
Do you virtually jump out of your vehicle, carry your equipment, and get to the patient as soon as possible?
Yes.
How did you all know where the patient was in this particular instance?
We pulled up and it was obvious that where he was at.
Where was the patient?
He was laying on the ground.
Was he near anything? Do you recall a vehicle near him?
He was laying right where they had parked, it appeared. He was laying right on the ground, supine, face up.
Was there anyone near him when you approached?
I don't recall. In that situation, we'd go straight to him.
Tell the jurors, what's your focus when you get out there?
We go straight to him and whatever's going on outside of the patient, we don't pay much attention to.
Does that include not being able to take the time to worry about physical evidence?
Yes.
If you step on something, do you have the time to worry about it, or is the patient's life the most important thing going on?
The patient's the priority.
Okay. So did you assess this patient, and refer to your notes if you need to, when you first got to him?
Per my notes, we found him, he was pulseless. We started CPR.
Let me stop you right there. Tell the jurors what you mean by pulseless.
He didn't have a pulse.
Where
Not
did you
breathing.
check for a pulse, if you recall?
I don't recall, but standard procedure would say we would check a carotid pulse and let's see if he was breathing.
All right. Did you detect any signs of a pulse at all?
No.
Throughout the time you dealt with this patient, from the time you touched him at the Gate gas station to the time you delivered him to the hospital, did he ever regain a pulse?
No.
Okay. What else did you assess with this patient?
We would look for injuries. We found one gunshot wound to his right mid-axillary line, which is your right side,
May he
essentially.
stand?
Yes, ma'am.
All right, would you please stand? And would you show the jurors where you found a wound? Is it where you're touching?
Right here on my right side.
Your right side. All right, sir. And did you do that by lifting his shirt?
I don't recall, but standard procedure says we cut their clothes off in that situation
All right.
and see what we can find.
Resume. Now let's talk just a moment about cutting clothes off. Again, we talked briefly about evidence that could be around a patient, but in cutting their clothes off, do you have the time to worry about where that gunshot wound entered the clothing before it entered the body?
No, we just get their clothes off.
You just get them off as quick as you can? Okay. So then, after you found that gunshot wound, what were you able to do to treat that specific wound?
We just applied direct pressure, try and control the bleeding, along with giving CPR and other procedures we were doing.
Did you intubate this patient?
Yes.
Was he ever able to breathe on his own?
No.
Okay. Are you also trying to load him up to get him into the rescue unit at the same time you all are doing all these other life-saving measures?
Yes, we started CPR, put him on a stretcher, and then continued once we got in the truck.
All right. And once you get to a patient, do you ever stop touching or working on that patient to try to save his life?
No.
Were you able to save Jordan Davis's life?
No.
How long, well, let me ask you to look again at your report. What time did you all leave the Gate gas station with Jordan Davis?
We left at 1954,
Okay, so 7:54 p.m.?
7:54 p.m.
And where did you take him?
Shands.
Tell the jurors where Shands Hospital is.
Shane's is off of 8th Street off 95. It took us, looks like 13 minutes to get there. It's a trauma center.
Okay. And is that protocol for Jack's Fire and Rescue to take gunshot wound patients to the downtown rather than to the closest hospital?
Right, it's a trauma center.
In that 13 minutes, did you and your colleagues continue to try to work on Jordan Davis to resuscitate him and save his life?
Yes.
Were you able to do that?
No.
Did you turn Jordan Davis himself and all of his clothing and belongings over to the Shands Hospital personnel when you arrived?
Yes.
Did you have any further involvement in this case?
No.
May I have a moment with co-counsel?
Yes, ma'am.
That's all. Thank you, Your Honor.
Mr. Stroller?
Yes, Ron, just have a moment.
Yes, sir.
Good morning, Mr. Spicer, how are you?
Good morning.
Now, did you say there's a difference between being a paramedic and an EMT?
Yes.
Okay, can you tell the jury what the difference is?
Being a paramedic is just further training. Once you've completed EMT training, you're able to do more advanced life-saving procedures.
Okay, and you're an EMT, correct?
Yes.
And the person you were with driving the rig was also an EMT?
Let me stop you. EMT, and I'm also a paramedic. I hold both licenses.
Okay, so you
Yes.
even got extra training?
Right, I'm a paramedic, yes.
Okay, I apologize.
No problem at all.
I want to give you credit for your training.
All right.
Your partner, who was driving the rig, correct? Or
Yes.
you weren't driving, correct?
No,
Okay, and your partner is also a paramedic?
I'm not sure if he was an EMT or a paramedic. He was one of the two.
What do you mean he was one of the two?
You have to be an EMT to be employed by the fire department.
Right.
But you could possibly be a paramedic.
Okay, and have you worked with that gentleman before?
I don't recall.
Okay, and as you sit here today, you don't know if he's a paramedic versus an EMT?
I don't know.
Okay, that's okay. Now, can you tell the jury a little bit, how long ago did you say you started your EMT training? Because EMT comes before paramedic, correct?
Right.
So tell the jury when you started your EMT training.
That was in May of 2005 when I went to school for EMT.
Okay, and how long did you go to school?
EMT school was approximately 3.5 months.
Okay, and in that 3.5 months, is it basically full-time, 40 hours a week?
No, I believe it was 3 days a week.
Okay, and did you have to take tests?
Yes.
Did you have to get training?
Yes.
Were you trained by other people qualified and experienced in that training?
Yes.
Okay, you weren't being trained by the Jacksonville Beach lifeguards, correct?
No.
Okay. Now, when you do your 3 months, you said 3 months of training for EMT?
Yes.
Did you graduate with a certificate?
Yes.
Did you do okay to get passed?
Yes.
Okay. How long then were you an EMT before you became a paramedic?
I'm not sure.
Okay. Talk to the jury, tell me if you could educate me, and I apologize. What do you have to do to go from an EMT to a paramedic?
You go to school, you spend time in the classroom or in hospitals along with doing ride-alongs and learning new procedures and more advanced procedures.
How long did that take to go from an EMT to a paramedic?
This school took me approximately a year.
A year?
Yes.
Did you do it full-time?
Yes.
So even full-time, it took you a year to get through all the training necessary to have that higher education of a paramedic.
Yes.
And you recall the call going out, or you were dispatched at 7:44 that evening? I know we used military terms before, but 7:44 p.m.?
Yes.
And it only took you a few minutes to get there. You arrived 4 minutes later, correct?
Yes.
And in your report that you referred to, Ms. Corey, you actually had contact with Mr. Davis 2 minutes after you got there.
I would have to reference my...
Go ahead and reference. Or 7:49, patient contact, is that correct? If you don't have page numbers on your report, so I apologize.
I do not, no problem.
It looks like page 3 at the top. If you want to look at page 3,
I do not.
do you have page 3 or would you like me to approach?
Approach me, please.
Judge, if I may, and for the record, I'm showing page 3 to the witness of the JRF report. Sir, do you recognize the report I'm showing you?
Yes.
Is that the report you've referred to with Ms. Corey?
Yes.
Okay, is that page 3?
Yes.
Is this your same report?
Yes.
Does that indicate times laid out pretty clearly?
Yes.
Okay. It looks like you arrived at 7:48, had patient contact at 7:49,
Yes.
and you departed at 7:54, correct?
Yes.
Okay. Now again, when you came on scene, was there anything different with this gunshot scene as any other gunshot scenes you've ever gone to before?
Every scene is unique, but nothing struck me as abnormal.
Okay. And how many gunshot scenes have you gone to in your career as an EMT or paramedic?
I don't know.
Can you give me an estimate? 10, 50, 100, 500,
100.
100? And that's in your 7-year career?
Yes.
And did you perform your duties, just like you have in all those other 100 times as a paramedic, what you did that evening?
Yes.
You didn't stop and talk to police, anything like that?
No.
They didn't pull you aside to show you evidence, anything like that?
No.
Did you see anything that you believed to be evidence? Did you see, were you kicking shell casings out of the way, moving stuff out of the way, or was the patient there and you said people were just around him, correct?
Correct.
And matter of fact, you indicated, and correct me if I'm wrong, you can't even recall who was standing around him, but people were standing around him.
Correct. There was people in the vicinity.
That's what I'm asking you. And
Right.
obviously, you don't know who they were. Right? Was anybody on top of Mr. Davis or working on Mr. Davis?
Not that I recall.
Okay. Now, you said something with Miss Corey that you checked for a pulse through the carotid pulse.
That's what we typically do. I don't specifically recall doing that, but that's how I checked if they have pulseless.
Okay, let me ask you this. Can you show the jury how you would check for that? And you could show it on yourself if you don't mind.
Stick 2 fingers right where artery is and see if you can feel a pulse.
Now, let me ask you this. Did you receive specialized training to find someone's carotid artery to check a pulse?
Yes.
Did you get that training as an EMT?
Yes.
Did you get enhanced training as a paramedic?
Yes.
Were you actually taught by you said you went to hospitals in your training, correct?
Yes.
You were actually trained by medical doctors how to do that and find the pulse to even further your skill on that, correct?
The doctors did give us further training, yes.
Okay. Now, Ms. Corey also said that, I think she said, did you incubate Mr. Davis?
Intubate, yes.
Why do you do that?
It secures an airway. It's a tube that's able to go directly into the trachea, so you have a direct line to their lungs.
And then that's in case for life-saving measures, as you're giving chest compressions, you can get air going through the lungs so that the brain doesn't die, correct?
Correct.
Nothing further, Judge.
No further questions, Your Honor.
Thank you, sir. He may be excused.